mind being on camera?
Oh, go ahead.
Okay, good. Okay. Is this on YouTube? It's gonna be super long. I'm not even gonna say anything because they already know. Y'all, we're gonna do a quick spirit box session. I'm gonna just wait for y'all to join. I don't even know how good the signal is in here, so don't mind me. But hey, Heather. Hey, everybody. I'm gonna wait for a couple more of y'all to join in. Okay. But I know y'all been asking about my dad too, so I also wanted to bring y'all in here and show y'all, because I know y'all been sending y'all prayers and y'all love and support too. Hey, Graham. Hey, Sandy. Hey, everybody. Hey, guys. We're gonna do a quick spirit box session, y'all. This is a real quick one. And I'm not gonna say nothing, just let me know what you heard in the comments, because I don't have my speaker. And I don't want to be too loud because we're in ICU. Y'all want to see my dad? I don't know if he want to be on camera. But he over here. Hey, Yolanda. Hey, Sandy. Hey, Melissa. Yeah, so they...
Don't put that on here.
Oh, yeah, I'm not... Okay. You're right. So they did move him to a different hospital, so that's a good thing. You know what I'm saying?
Because that's going to be out there.
Yeah, I'm not putting him on live. You good. It's just the sound of it.
That's fine.
All right, cool. Hey, Spider Queen. How you guys? Let me know if it's loud or not. I don't know. I can't turn it up too loud though. Let me know what you guys hear, okay? Because I can't really ask questions. We are in the hospital with my dad. Hi, Tara. Tell me what you hear.
This machine, let me check.
Okay. Let me get out your way. Hold on.
It's always like this, the thing is sipping through it. It's sipping through it, like this all the time.
Sipping,
Like
leaking
leaking out, leaking fluid.
Well, when I seen him in the hospital at the other place, that was my first time seeing that like that. So I didn't know if it was leaking or not. But
It's from the swelling, so it's escaping from the, from the.
That's the IV fluid.
No, the IV is right over here. It's too swollen. So when fluids is accumulated there, so when it tries to get out, it leaks out.
So how long is that gonna be like that?
Well, in this condition, because it's always in bed. When you're in bed, all your muscles are in relaxed mode, so it's not being squeezed out from the kidney has to really push it in and pull it out, and then you have to repeat. So I have to talk to the nephrologist whether they need a certain like a diuretic to push out the fluid so he can pee it out.
He's not on Lasix?
No, not on Lasix.
He's not on any type of water pill?
No, no, because I just got the OG tube clearance that we could use that one because you have to go to the X-ray to make sure it's in the stomach. So I got the result. It's in the stomach. I still have to work on the dietitian to which formula to start because the formula that he has on the hospital is quite different. So I need to know how compatible it is. So the dietitian has to, and we still have to start like it is slow because sometimes if it's too fast, he might throw up. Yeah.
Makes sense.
And so he'll be able to tolerate, digest it. And if you tolerate that formula, because it's a different formula, because we don't have that formula as compared to the previous facility, then, we could increase it according to his caloric needs.
Right. And so how come they don't have compression socks on?
The thing is,
I understand it's swollen and everything, but is it that the compression socks are not going to help at this point, or why?
Not this time. It's mostly they might give him like because the thing is, I think the platelet's kind of a little low. He might put him on a certain blood thinner so to prevent it from having clots. But contraindication, platelet is low right now. So it was, I think, like 17. Now it's 41. So nothing has been given to make him coagulate. So the platelet's going up now, slowly. So we're waiting for that moment. So there's a hematologist that needs to see why his platelet's down.
Right.
To determine what's the cause.
Exactly.
Is it the liver or something?
He's in ICU right now.
He's sepsis though.
Yeah, I know, but sometimes the one that's doing the coagulation is the liver. So they have to check, hey, is the liver functioning properly?
Right.
Because that's where the platelets originate and everything.
But don't you think that he should have had all that stuff done at the other hospital?
Well, the thing is, the hospital setting is short term.
Thank you.
Whatever they can do to stabilize it,
Right.
immediately they call insurance. We need to discharge this patient.
Yeah.
That's how it works. That's why they're like, immediately, hey, if you have any facility that they can take him, oh, we have Kindred there.
I wish they could have put him in the one in San Diego.
Oh, you live in San Diego?
Yes.
Oh, I lived in San Diego before.
It's a lot easier for us to get to.
Where in San
Yeah.
Diego do you live?
Like Lemon Grove area, La Mesa.
Oh, La Mesa. There's
It's one off of El Cajon Boulevard.
yeah, there's La Mesa Community, like Sabakit facility there also.
It's the Kindred.
There's a Kindred also, but it's all down there.
It's fine though,
Yeah, I
because
know.
we live close. That's where we live at.
Well, the one that's controlling it is you. First place, you say, hey, we're gonna put it on Ontario. Is there any other alternative close to me?
I just
they
wanted to,
say
we're gonna do a spirit box session. Am I clear though? I was trying to do it, but I don't want the signal to be blurry. Just real quick, because we're in a hospital. We're in a hospital. So, am I clear? Are we good?
Insurance says, okay.
Can you hear me? You can hear me? Okay. Okay.
So when he goes, it's gonna be more
So
stable.
I just want you guys to listen to the spirit box, okay? I can't ask any questions. I can, but I don't want to be loud because my dad's in there. Resting. So let me know what it is that you hear when the doctor goes out.
At the front, when you go security, see that on the left side. There's on the left side. That's where all the case manager we go together.
Okay.
Okay. The right people, you need to know the right people
Exactly.
to approach.
I feel very comfortable with him here too.
Yeah, because the other place we didn't like it at all.
Oh, which place?
The hospital he was at in Victorville.
Where's that?
I have no idea.
It's
Desert
far from
Valley?
here.
Or
It's by Vegas, almost going towards
3 hours
more.
from Vegas. It may be Desert Valley. I don't know. It seemed like it's in the middle of nowhere.
St. Mary Desert, because Victorville has 3 hospitals. I used to live in Victorville. That's
It's
why.
a small one, like, it
Global?
looks like a convalescent hospital to me.
Mhm.
It's so small.
Hospital, not
It's a
nursing home.
hospital.
There's Desert
Thank you,
Valley.
Kim.
There's St. Mary.
Appreciate you.
St. Mary is also small down there. And the Global is on top of the hill.
Well, this one sits out in, it looks like a desert. Like nothing's around it.
Is it in Valley Boulevard?
It could be. I don't know. Tiffany, you don't
Yeah,
remember?
that's Desert
What
Valley.
it's called?
Desert
Desert
Valley.
Valley, yeah.
Oh, yeah,
Because it's nothing
that's
around.
I
a
don't
prime
like
hospital.
that one.
Yeah.
That one
Yeah.
is, it's like they don't have the equipment and the stuff they need to
Mhm.
take care of him. My concern when I was there with him, his lips were so chapped, right?
Mm,
They wasn't doing anything for him.
mm,
And then you know, like the little sponge that you put in your mouth to keep
Mhm.
it saturated,
mhm.
because when you have like air, your mouth gets really dry.
Dry, yeah, because of the blowing of the air.
Constant.
Yeah.
They weren't doing that.
Mm.
And to me, it's like, how could he even swallow or do anything if his mouth is not saturated
Mhm.
and his lips are still dry? So I got one of those Q-tip things
Mhm.
in there and dipped it in some Vaseline and put it all over his lips
Put y'all right
because
here.
his skin was just falling off.
Okay, this is reality about the hospital. When you come into the hospital with a broken leg already on a cast and you came in for chest pain, the doctor will just entertain your chest pain.
Exactly.
Basically, that's what they're doing
Exactly.
because that's where they're coding and billing the
That's
chest
true,
pain.
but
That's-
if they see that on a patient,
They don't.
They don't care,
They don't
huh?
care. It's a secondary thing. That's not their priority. That's the hospital. That's what's
Mhm.
called a short term,
yeah.
and they will endorse it to the person or to the facility that can handle that, plus the current diagnosis.
Yeah, but as far
How
as
you need to
like
get in here?
the
Yeah.
little
Okay.
sponge in his mouth, you would think that that's something that's necessary.
Yeah.
But they didn't even do that. It was like, hi,
Oh, I'm respiratory. Gonna give him a breathing treatment in a second.
Oh, okay.
breathing treatment?
Yeah.
Okay.
All right, let me get my
So
stuff over
that's
here.
they have their own. I don't know. They have their own priorities on what, you know.
I didn't like it. We feel more comfortable with it.
I used to work there. Is it on 4th floor?
Was it on the 4th floor or second?
Second.
A second.
There is no fourth floor.
Oh, that's probably just bad because there's a 4th floor there where they do open heart or something.
No,
Yeah.
this one was like a little bitty, looks like a convalescent, but they said it was a hospital.
Mm-hmm.
I don't know. Only been there once. Dad, you got to get your breathing treatment. That's the cat we, he's a fisherman.
Yeah.
He taught us how to fish. So it
In
was only,
Victorville?
no, in San Diego. He
Oh,
lived
Yeah.
in San Diego.
in Lemon Grove,
No, he lived in San Diego.
San Diego.
Yeah.
San Diego. Okay.
Yeah.
It's nice there. It's just.
Expensive.
Is it expensive up here? How is it?
It's okay, but San Diego, the water is expensive. Everything is like, what? My bill is 500. It was only 200 before. It's climbing up because
Higher and higher.
in my area, we buy water,
Mm.
and then San Diego is like they're the third party
Mhm.
that's distributing it, and they're
Mhm.
selling water to the residential.
Yep, that's
So
true.
that's
Very
what
expensive.
we don't even on the north side. We don't even have a fireman or firehouse for
Oh.
the. So we belong to a certain fire department that's like not even part. It's all the way in the north area.
Where'd you live at?
Thank you.
Fallbrook.
Oh, no.
You don't like Fallbrook? What's wrong with
It's-
Fallbrook?
I'm a San Diego girl. I'm sorry.
But I used to work at El Cajon.
Mm-hmm.
Yeah, where there's a lot of homeless. What the hell? It's like, is this a bus stop? How come there's a
It's-
tent?
It's so bad now with
Yeah.
homeless people down there now.
Yeah.
You see them.
Thank you, guys.
It's a
I
thing
love you
that's
guys so
only
much.
2019
We gonna sneak to the
or
hallway and do a
20 when I
spirit
was
box
there.
session.
It's worse now.
Okay.
It's like when you see, how come there's a
worry, I
bubble
got you.
pack here of medication?
It's worse
Really?
now.
Yeah, I remember. There's always those. In El Cajon, there's a
Alright,
24-hour
you
taco
okay?
place that we buy. It's like, hey. Yeah, it's getting worse now.
Mm-hmm.
Well, it
they
looked like
dropping
it hurt.
someone there, like from the border, and then I saw like bus. They're dropping people. Like, where are these people going? There's no place to put.
That's true. It's sad.
We also have people here that needs a place to go, and there's still people coming. Where are they gonna go?
That's so true. it's getting so bad to
Thank you,
where
Spider.
the senior citizens can't even afford their places anymore because they're on a fixed income.
I think we're in trouble. We're going to be senior citizens.
I'm gonna
And
step
you
out
say
real
when,
quick.
when on TV,
I'll be right
they say,
back.
where did you go for your
Oh shoot, hold on, I need my bag. I don't want the
Right
signal
now,
to
it's
cut
like,
off.
are you sure you want to go San Diego now?
Hold on.
I don't know why. Where you going?
Right out here.
Oh, where's your go?
To the car. To get something.
And I know they always like, Trump. They always have the flag of Trump in downtown San Diego. Yeah.
His favorite spot was Seaport Village.
Yeah.
Oh, really?
Yeah. He used to always go to Seaport Village. And
Actually,
taught us how to fish and everything.
Oh, that's nice.
Yeah.
I'll
He had
sit right
6
here.
girls.
Imagine that.
I'm staying here.
feeling.
I'm gonna stay. We're gonna stay in here. I got this, the iPad.
Alright, so I'm giving him his medication for this year.
After that, I'll take
What
over.
is that?
So it's albuterol, Atrovent, and Mucomyst.
Oh wow, all of them?
Yeah, so he gets like the bronchodilator. Because the Mucomyst is good to have it with albuterol. It's not good to have it on long run.
Bear and
So how much
Max.
air are you getting?
Bear and Max are out.
So right now he's on a full support, the
Oh
ventilator.
really?
Yeah. And then his oxygen is 30%. It's not bad on oxygenation part.
Okay.
So so my plan is to start tomorrow, see what his baseline on weaning to breathe a lot on his own with minimal support on the ventilator to see what's his, and then so we know, how far can we push him to wean.
Yeah, but you guys are not gonna keep taking that out and putting it back in though, right?
What, the tube?
Yeah.
Well, the only thing is, if he cannot protect his airway, let's say we take it out, because so by saying weaning, we're not gonna do anything. We're not gonna take
Just
anything.
gonna lower it.
Just lower this.
Should I go out
just
here
lower
or stay
these
in here and do
numbers
it?
and
Right.
see how well he can tolerate it on the lower side. If
Okay.
if he can tolerate the very minimal,
Mm-hmm.
then the next step is to think of taking the tube out.
Yeah, but then you might have to put it back in.
Right.
And every time you do that, it's tearing up his mouth.
Right.
inside.
So
Yep.
if we have to put it back in, then he's qualified for what we call trach. Yeah.
And how is that gonna look?
Yeah.
Just be honest. How is it gonna look?
That's unfortunately we cannot keep this on more.
So is it gonna be an open?
So it's gonna be what they do is if let's say they went to that route.
Okay.
So it's gonna be like an opening in the neck,
Right.
and then instead of this in his mouth, will be
It'll
on
be-
his neck right here.
But you can't see in there, right? It's gonna be taped up.
Yeah, it's gonna be the tube is in here, and this is the only thing you're gonna see is this part, and everything else will.
When he breathes, is it gonna be like?
No,
Yeah.
it's gonna be
Normal?
normal. Because what we're doing, we're just biasing his mouth and nose,
Okay.
airway,
So
and
then,
then we're going directly into his trachea or his lung windpipe.
and then when you take that out, it's gonna be an ugly scar there, huh?
I mean, from each, it depends from one person to another. I mean, it's not ugly,
We
but
keloid. You see this?
oh, I see.
You see that?
Oh, yeah.
What is it?
Oh, I see.
Open heart.
Oh, yeah.
Did you have open heart?
I had triple bypass
Oh, wow. Long time
last
ago.
February. Not this February. I just passed last year.
What? Oh, recent? Where? Which
In
one?
San Diego at Grossman Shop.
Oh, I see. Yeah, so, yeah, I mean, I'm not saying he's there yet for the trach, but usually that's the routes if we continue.
Listen, we in the hospital, we gotta take advantage. We got a job to
So
do.
that's probably the doctor will start telling you.
We got a job to do.
Hey, are you considering trach? Yes or no, and they'll tell you everything about it. Yeah. The good thing is, let's say he's able to get his strength back and he's able to talk and everything. With the trach, he can.
Oh,
Yeah.
he
Oh, that's
can?
cool.
He
Yeah.
can? I was just about to ask you that because
Yeah.
I wanted to know with that in his throat.
Yeah, he'll be
Yeah.
able to talk. We'll be adding like a little piece of device, like a little.
Is it gonna be sounding funny like? Wah,
Yeah, like a smoker.
No, it's okay, but
Like
you
a
know how
smoker
sometimes
commercial?
they have to put that thing
Oh,
there.
that's different. No.
Oh, okay.
Yeah, it'll be his voice.
Yeah, like the
Not that
commercial.
No, that one is.
like
the
a
one you're talking
microphone.
about,
Yeah, yeah.
They're using
Yeah.
the vibration on the neck
Yes.
to make it robot sound
in
like.
here, yeah.
But this one he'll be using his own
Oh,
voice.
voice.
So why
Okay.
doesn't he use his voice now? Before that was in him.
Before he was not talking. Before they put the tube in.
Yeah, he wasn't saying
So I
nothing.
don't know what's his condition then. Like, what's his vocal cord too weak? to use? Was it something going on with the vocal cord? Because if he's having trouble with that, sometimes could be inflammation, could be anything going on there. So even if we put the trach on and he's able to try to talk, and if he couldn't talk before, it's not going to make any difference.
Because nobody ever said anything about his voice or why he doesn't say anything.
Right, yeah.
And no one said why he doesn't talk.
Yeah. So yeah, if we do the trach and the patient able to eat, drink, and talk, yes, they can. If they can tolerate it, that's another thing. You know, some patients cannot tolerate that valve one, which we'll call the valve.
Yeah.
Okay. So yeah. Yeah, that's again, you know, it's up to you guys. Because we can keep it. I think the 8 to
76.
up to like 20 to maybe 30 days, the max we can ever do that.
Yeah,
If we
I
have
get
to
it.
push it. Yeah. Because next thing he's gonna get pneumonia, infections, and all that.
And
Yeah.
gonna be 10 times
That's because
worse.
it's open?
Yeah, it's no
With that thing is finished. Yeah, they can't
because
leave it in
the
there.
other mouth bacteria and saliva will manage its way to get into the lungs and cause the infections.
Okay.
That's why I
That
was
makes
wondering
sense.
What was all that? Like, if he has that in his mouth needs to
Yep.
stay clean.
Right.
Yeah.
So that black stuff that's all in his beard.
It's gonna get because all this is dryness and because he doesn't have the natural moist anymore.
Exactly.
And usually what we do, we clean the oral, we do the oral care with
that sponge
solution,
thing.
but that's not gonna be sufficient to protect his mouth from getting bacteria and infections and dryness and all that.
So then what do they use? Like, okay, say this 30 days that he's on that. What are they using to prevent it? Nothing?
Well, there's not much to prevent it, but what the prevention is to remove it.
Right.
And put a trach, and then from there, the moisture is going to come back, the mouth is going to heal, because the mouth usually heals very quickly. It's moist and everything, and things will go back into normal.
Okay.
But if he's not eating or drinking, that's another possibility of bacteria building in the mouth.
Yeah.
And that's something that's very difficult to prevent, because the patient's not eating or drinking, and rinsing the mouth like natural, that we do on a daily basis. So usually they'll build up.
Okay.
So do they try to rinse his mouth out every day?
Yeah, we use that. We do it twice a day. But again, the tube is in the way.
Yeah, I get it.
Yeah.
You give only so much you can
Yeah,
do.
exactly.
I get it.
Yeah. So, yeah, I mean, I know it's difficult. It's you guys next to him watching.
I've
know how
never
it feels.
seen him
Me
like
either.
this.
Right.
2 years ago, he wasn't like this.
Right. Yeah.
And so to see him like this is just like, what the hell happened?
Yeah. Exactly. 'Cause
I wish
for
it
him,
was.
we can give him the pain meds. We can get him not to feel anything. But for you guys, it's gonna be. I get it. Like because you're watching him, by looking at him makes
It looks like he's seeing through you and not at you when he's sedated and all these different
because any
medicines.
patient, not just him, any patient in hospital settings with closed environments and everything, they start going into their own world in a way. So you have to keep talking to them and everything. And then usually they'll come back once they get recovered.
Yeah.
But the question is, not every patient. How fast each patient will recover? It's hard to know.
Up to that
Has
person,
anyone
Oh
ever?
yeah, we have patient walk home after all this.
Really?
Oh yeah, but again, like
It just depends on the
It depends
willpower.
on the individual of
His
the
willpower to
body.
fight.
Reverse all this problems. Each patient is different from others.
Yeah.
So it's basically, summarize it, it's not a plan.
Yeah.
It's just, we'll give all the treatment necessary, and we'll wait for the response of his body.
So what is all that? Is that wet from him?
Yeah, no, this is just when we suction.
I am
because of
Susanna,
that
thank
moist,
you.
Because we need that to be in there to humidify his airway, not to dry. So we have this bacteria and humidification filter. And you can see
I
that
do,
moist,
I
which
do.
is- That's okay. And then
I know
this
you
is the
guys
suction,
wanted an
because we don't
update,
wanna
so
have
that's why I'm
exposed
also
area
here. It's not just for
Right.
So this
a
is
session.
sterile, clean.
I know you guys care, so.
Yeah, but I'm talking about the mattress where it's all wet at.
Oh, this?
Mm-hmm.
Oh, I don't know. Probably the nurse will have to change him. I'm hoping that's not one of the feeding or anything. I'll let the nurse know. Maybe something was leaking underneath.
Because
I'm not sure. I'll have to ask the nurse on that.
He said he was gonna clean them up, so.
Yeah,
I'm
he's,
sure he'll
because
do
right
it.
now, like, they're usually, this is the time when they start bathing and cleaning the patients. So if you guys wanna say
Yes,
goodbye
I
to
am.
him or something,
We just
yeah,
went
you
to
can come in all the bathing.
what's that place called?
All right.
Thank you.
With the
for-
hibachi and they cook it in
Yeah,
front of
no
you.
problem.
We
I'm
went
here
there.
tomorrow. If you guys
We
come
just
back
came from
tomorrow
there.
and you're here,
We've been
have
up here
questions,
since 8
please let me
a.m.
know.
Thank you
Alright.
so much. What's your name?
Hatim.
Hatim. Nice to meet you.
Oh,
Thank you
nice
for.
to- oh,
I'm
let me
sorry.
take off my glasses.
Thank you for all your help and
Oh,
everything
no problem.
you do.
Anytime,
Yeah.
anytime. Yeah.
Yeah.
All right.
Yeah.
So I'm just gonna.
Oh,
put this
sure.
in there.
Yep.
Yeah, we're gonna go so that they can clean you up and stuff. They need to change your bedding and change you so you can be comfortable. But we'll come back and see you again, okay?
Next
Guys live
next
far?
weekend.
San Diego.
Yeah.
Oh
No.
gosh. Oh, you guys talking about San Diego? You guys live in
Yeah,
San
we
Diego?
live there.
Oh, no, I thought you used to live
Yeah.
there.
No.
Oh my gosh.
We
it's a
will
long
drive
isn't it?
anywhere. We will drive
That's why
anywhere.
we wish we
to
could
see
get
my
you
dad.
closer.
Right.
And
There's
we
no
just-
kinder like that in
Yes,
San
they
Diego?
do. They do, but it's like, okay, with him being the way he is it safe for him to travel that far?
Right. I mean, on those settings, with the paramedics, they'll travel him on the ventilators.
I wish they
Yeah.
could. I don't know how to get that to happen, but we really wish that he
You
could
can,
go.
Yeah.
if you want to do that, you have to come on Monday. So you can ask the social services
They
department.
told us to contact the social service.
Yeah, and then they'll manage it. And if they have beds in San Diego, there should no reason to say no because he's not on the high settings.
Mhm.
And those settings are transferable settings.
Okay.
They are.
Yeah,
That's
he can go
good.
anywhere with those because that's why he was able to come to us because those settings are
Exactly.
it's not danger.
Mhm.
I was thinking once he get a little bit more settled here and they feed him and he's a
Feed
little
him.
stronger,
Hibachi.
then maybe they can transfer him then.
Right. I mean, it doesn't matter
Don't
if
sing that song.
anything.
Don't
You
sing.
can go anywhere because he'll take whatever treatments from here, but it's up to you guys.
Yeah, that's what we want.
Yeah, if that's something you guys are easy for you guys, I would say I'll work on it.
Yeah.
That way you don't have to do all the driving for no reason.
It would be
He's
so
gonna
much
do
better.
The same treatments here,
That he
there.
went there.
It's the same system,
Mhm.
and we're gonna just tell him what he's at, and then he's just gonna continue. It'll be easy for you guys.
Yeah.
Yeah. All right.
All right.
Okay.
Thank you so
You're welcome.
much.
Dad, I love you. Hey, I love you. Just go ahead and rest. We'll be back to see you. Don't worry.
Yeah. Don't lose your hat either. Okay. Don't let nobody take it.
His name is on it, so.
Look at the hat we got my dad. Cause he loves to fish.
I love you, Dad.
Oh. I love you. You gonna be okay, okay? Alright? Don't try to escape either. Don't be trying to break out of here at night. Alright? You need me, call me. I will help you. I'll be your partner. I love you, okay? We will be back.
You want this on your head? Dad, you want me to put this back on your head? Your hat?
Y'all, we gonna thank you so much for your prayers and your
later,
love.
okay?
Thank you so much.
Hey, look at me. I'll see you later, okay? I'm gonna come back to see you. Okay? I love you. I love you, Dad.
Dad, you also have a lot of people all over the world that love you too, okay? I just wanted, because they're telling me to tell you. They can't see you, but they know that you're here. And they all wanted me to tell you that they love you and that they're praying for you, okay?
Got a lot of people praying for you.
You got people from Canada. You got people from, where y'all from? It's a lot of people from all over the world.
Get you some rest.
Yeah.
We'll be back to see you.
Love you.
Love you, Dad. Love you.
Y'all, I'm gonna be out of here. We're probably not gonna finish the session, but I'll see y'all later. I love you guys.